Hello everyone, welcome to my YouTube channel. If you're joining for the first time, don't forget to click the subscription button down there. So today I want to talk about urinary tract infection, which is an infection in any part of the urinary tract system. The urinary tract system includes the kidneys, ureters, bladder and the urethra. Most infections involve the lower urinary tract, which includes the bladder and the urethra. It is also important to note that women are at a greater risk of developing a UTI than men. If an infection is limited to the bladder, it can also be painful and annoying, but serious health problems can result if UTI spreads to your kidney. Now, let's talk about symptoms of the UTIs. UTIs don't always cause symptoms, but when they do, it may include a strong urge to urinate that doesn't go away, a burning feeling of urinating oftenly and passing small amounts of urine that looks cloudy, urine that appears red, bright pink or cola colored, which is a sign of blood in your urine, a strong smelling urine, and pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. You also need to understand that in older adults, UTI may be overlooked or mistaken for other conditions. Additionally, it is also important that the symptoms I've talked about can also be caused by other diseases. So it is very, very important for you to ensure that you visit an hospital to be sure if you are really having UTI or it is a symptom of other medical condition. Now, let's explore the types of urinary tract infection. Each type of UTI may result in more specific symptoms. The symptoms may depend on which part of the urinary tract is affected. For example, kidneys. You will experience back or side pain, higher fever, vomiting, shaking and chills. And for the bladder, you will experience pelvic pressure, lower belly discomfort, frequent painful urination and blood in the urine. For the urethra, you will also experience burning urination and discharge. Now, let's look at what causes UTIs. Typically, UTIs occurs when bacteria enter the urinary tract through the urethra and begin to spread in the bladder. The urinary system is designed to keep out the bacteria, but the defenses sometimes fail. So when that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract system. So, the most common UTIs occur mainly in women and affect the bladder and the urethra. Now, let's talk about risk factors that may increase your chances of getting UTI infections. UTIs are more common in women, and many women experience more than one UTI during their lifetimes. Risk factors for UTI that are specific to women include female anatomy. This means that women have a shorter urethra than men do. As a result, there is less distance for the bacteria to travel to reach the bladder. Secondly, sexual activity. Being sexually active tends to lead to more UTIs. Having a new sexual partner also increases your chances of getting these UTIs as well. Number 3, certain types of birth control. Using diaphragms for birth control may also increase the risk of UTIs. And again, if you are also using spermicidal agents also, these can also put you at a risk. Lastly, menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract. These changes can increase the risk of UTI. Other risk factors for UTIs may include urinary tract problems, blockages in the urinary tract, a suppressed immune system, and a recent urinary procedure. For example, if you had a urinary surgery or an exam of your urinary tract that involves medical instruments, can both increase the risk of developing a UTI. Now, what are some of the complications associated with UTIs? You need to understand that when treated promptly and properly, lower urinary tract infection rarely lead to complications, but when left untreated, UTIs can also cause serious health problems. Complications of UTI may include repeated infections, permanent kidney damage from a kidney infection due to untreated UTI, delivering a low birth weight or premature infant when a UTI occurs during pregnancy, a narrowed urethra in men from having repeated infections of the urethra, and lastly, sepsis, a potential life-threatening complications of an infection. This is a risk, especially if the infection travels up the urinary tract of the kidneys. Now, lastly, let us explore some of the steps you can take to lower your risk of getting UTI. Number one, please drink plenty of liquids, especially water. Number two, you need to wipe from front to back, especially if you are a woman. This will help you prevent the spread of bacteria from the anus to the vagina and the urethra. You also need to empty your bladder soon after having sex. You also need to avoid potentially irritating feminine products. And lastly, please change your birth control, especially if you're using diaphragms, lubricated condoms or condoms treated with spermicide. These can contribute to bacterial growth. Thank you so much for listening. And once again, don't forget to subscribe so that you can see my videos anytime I post them. Thank you and have a lovely time ahead.